Hello everyone, I am Dr. P. Thilayas, Assistant Professor, Department of Pharmacy Practice. Today we discuss about osteoarthritis. It is the disease on the arthritis. First of all, osteoarthritis is the silent epidemic. It is the silent epidemic. First of all, what is the definition of osteoarthritis means? That is the disease is a chronic degenerative joint disease where articular cartilage breakdowns and leading to bone on bone friction, pain or loss of motions. Sorry. It is the definition. What is meant by definition of osteoarthritis means it is a chronic, it is the chronic disease and also degenerative joint disease. It is the degenerative and where articular cartilage breaks down leading to bone on bone friction and pain and loss of motion. All of you know about cell injury. Cell injury is the reversible and irreversible. Reversible cell injury is the degenerative. It is the degenerative. What is the impact of osteoarthritis means 44% of adults over 70 years and 27% of under the old age people. It is approximately affected by adult means 25% in the world. So first of all, what is the who gets osteoarthritis and risk factors? There are two types: non-modifiable and modifiable. This non-modifiable means age 45 years and female sex, post 45 years, risk factors of twofold and hereditary collagen type 2 gene variants, and modifiable. It is the obesity, body mass index formula of weight in kg divided by height in meter square, and raises knee osteoarthritis risk and fourfold. And prior joint trauma means road traffic accident or any injury, and knee ligaments tear and malignment various and vulgus, and muscle weakness and metabolic disease, diabetics and gout. It is the metabolic disease of diabetics and gout. Diabetics means increased blood sugar level in the blood. There are many types of diabetics: type 1, type 2, gestational, neonatal diabetics, steroid induced diabetics, pre-diabetics, gestational diabetics. And also what is maybe gout means increase in the uric acid level. Increase in the uric acid level. It is also affected in the muscular system and the skeletal system. What is maybe pathophysiology of molecular fire starter? It is the understanding the cellular cascade that derives the joint distraction. First one is inflammation trigger. What is maybe inflammation trigger means interleukin 1b and TNF alpha active chondrocytes in overproduced matrix and metalloproteinase and cartilage breakdowns. It is the MMP destroy cartilage collagens while interleukin 1 and suppress TGF beta stimulate collagen 2 synthesis and reducing the repair capacity. Next, bone response. Increased osteoblast activity leads to the sclerosis and osteophyte and formation. It is the bone spurs. Next one is feedback loop. A cartilage remains in the damp producing the tissue damage. These are the pathophysiology of osteoarthritis. First one is inflammation trigger and cartilage breakdown and bone response and feedback loop. Inflammation trigger means any injury irritable to the bone or joints. It's the cartilage breakdown in the bone and the cartilage. It is disturbed by the some of the enzyme interleukins. This kind of enzyme affect the cartilage breakdown. And also bone response. It is the increased osteoblast activity leads to the sclerosis and osteophytic formation in the bone spurs. Next one is clinical picture and the symptoms and the signs. What are the symptoms and the sign of the osteoarthritis means? Pain pattern. Activity related to start of pain that worsens through the day. Minimal morning stiffness and lasting less than the 20 minutes. First line of symptoms of osteoarthritis means pain. Pain on the joint. It is a starting symptoms of pain. And minimal morning stiffness. Minimal morning stiffness lasts less than the 20 minutes. What are the physical signs means? Grating sound and joint effusions and bone enlargement. It is the herbadan and both nodes in the dip joints and reduced range of motions and occasionally instability. And also, what are the diagnosis and imaging lab toolkit means? X-ray, hallmark, and MRI, magnetic resonance imaging when needed. When it is needed to do the MRI, detects early cartilage loss and minimal tens and synovitis. And a laboratory rule out erythrocyte sedimentation rate and create C reactive proteins. ESR means erythrocyte sedative erythrocyte sedimentation rate, and CRP means C reactive protein, usually normal and rheumatoid factors and anti-CCP to exclude inflammatory arthritis, and synovial fluid analysis of if infection suspected. What are the clinical criteria means? ACA 2000 algorithm, pain and radiography changes in the secondary causes. These are the diagnosis of osteoarthritis. First one we will do the first X-ray, hallmark, and MRI. When it is needed, do the MRI, the laboratory rule out, and the clinical criteria. And the next one is what are the treatment involved in the osteoarthritis means? It's a first line drug, weight loss below the 5% of body weight, and the knee bone and the 20% structured and strengthening and the quadriceps and the hip abduction, and the analgesic. Analgesic is the used to do the pain. It is mainly used for the NSAID, non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. It is mainly used for the analgesic and pyretic. Analgesic and antipyretic. Analgesic means it is used for the pain. Antipyretic means it is reduced the temperature or fever. What are the analgesics we used in the osteoarthritis means? Acetaminophen, paracetamol, and naproxen and celecoxib. It is the mainly used for the osteoarthritis, and also used the diclofenac and also aceclofenac. These are all the NSAID drugs. So first of all, what are the NSAID drugs used in the osteoarthritis means? First one acetaminophen. Acetaminophen, this is nothing but paracetamol, and the class 1 and class 2 inhibitors, naproxen and celecoxib, and topical diclofenac. And intra-articular, what are the injection of intra-articular means? Triaminoglone and hyaluronic. These are the used for the intra-articular. Next one is advanced option. What are the advanced option means? Platelet rich plasma. These are the advanced plasma used in the rheumatoid osteoarthritis. So these are the treatment and pharmacology and procedural arsenal. First line drug is used for the NSAID drugs. NSAID drugs means paracetamol, celecoxib, naproxen, and diclofenac. And intra-articular means triamcinolone and hyaluronic acid. These drugs are used for the osteoarthritis. Next, what is the lifestyle modification means? Exercise prescription, low impact aerobic swimming and cycling on 50 minutes per week, and resistant training 2 to 3 weeks focusing on knee and stabilizing muscles, and assistive technology, canner walker for severe knee pain, the knee brace for the experimental and orthotics to correct malignment. These are the assistive technology. First, emerging horizon and future outlook. 3D printed scaffold infused with the MSC derived exposons being the implanted in a rabbit knee model. The vision in by 2030. In 2030, biological disease modifying the osteoarthritis above DMI drugs aim to halve MMP activity, potential shifting osteoarthritis from the palliative to curative paradigm. These are the emerging horizon and future outlook. So, what are the 10 knowledge into motion? Early screening and targeted weight loss and evidence-based medicine use and slash osteoarthritis to disability up to 30%. Let's make the osteoarthritis count. Okay. Today we discussed about what is meant by osteoarthritis. Osteoarthritis affected in the joint. Osteoarthritis. Joint means arthritis means inflammation of the joint. This is the meaning of arthritis. It is affected mainly in the joints. What are the symptoms of osteoarthritis means? First line symptom is pain and morning stiffness. And also what are the treatment of osteoarthritis? We use the mainly DMI drugs and NSAID drugs. What are the NSAID drugs used in the osteoarthritis means? Analgesic used for the pain, reduce the pain. Acetaminophen, naproxen and celecoxib, and also used for the diclofenac, topical diclofenac. These are all the overview of osteoarthritis. Okay, thank you.